Thank you for attending the HeelBone's training video. My name is Gwen and I am the creator of the HeelBone Pressure Relief Cushion by HeelBones. I work in a nursing facility, and as you probably all know, this is usually the way people are before they need to be in the hospital. Their legs are flat on the bed and their heels are digging into the mattress, as you can see. So we as responsible caregivers always try to float the heels, especially when the patient has problems with immobility or neurological impairment. So what do? The most typical thing we do, Anne, is we lift up the legs and we put a pillow under their legs like this. Very nice. No pressure on the heels. The feet are comfortable. You're comfortable, Anne?
Yeah.
The calves are supported, and we have a little bit of support under the knee. While the knees are open, we get some circulation. If you look, the calves are a little bit smushed, but no matter, the patient's comfortable. Then, what do? We're happy, everybody's happy, we walk out of the room and go resume our activities. And what happens when we come back? We walk back in, oh my goodness, what's happened? The patient is now shifted position. The pillow is only under one leg. Both heels are back digging into the mattress. So we're going, darn, I guess that's not working. So what do? Let's see. We use two pillows. Lift up the legs. Okay, maybe this will work. We're going to put two pillows under the legs. We're going to float both heels, and now there's going to be more room for the patient. She's still got her calves supported, a little bit smushed. The knees are well supported, and the heels are obviously floating off the bed. So we're happy, everybody's happy, comfortable, happy. We go resume our activities. Then we're ready to come back in the room a few minutes later. Oh my goodness, what has happened? Same thing. The patient has shifted. The patient's obviously moving so that because they are able to or want to, they may feel like the pillow is actually making their legs too elevated, and what a mess. We have pillows on the ground now. So why do we do it? Why do we continue to use $2 pillows to prevent a $20,000 mistake, expecting different results than we actually are getting? So after many years of frustration, I developed a floating cushion, a heel floating cushion that should work. I call it the HeelBone. It is an unusually shaped, wedge-shaped design. It has 3 layers. This is the bottom supportive layer of a denser yet soft foam, a middle layer that allows for a little bit of more softness, and a top memory foam layer to provide pressure distribution, softness, and comfort. I'll show you this cutout here to show you what we have in the center of the pillow. You can see that it dips a little bit. This is to allow efficient distribution across the calves, but it has a ridge here so that the knees can get some support also. The cutout here shows how the center hole is actually cored out so that there's room for the calves to distribute over there. The funny shapes here allow space for the patient to float their heels and other areas of the foot while still achieving support against the ankle joint. So there's many multitude of places where the patient can rest their feet but still get support. Even when the patient is turned to the side, we can have the heels float over the center holes or over these holes and still achieve pressure relief while keeping the patient comfortable. So it's very simple actually to apply. It's just another support device. You want to lift the patient's legs and slip them under here. Oh, I forgot to mention, can you cut? The cover of the cushion is made with a high-grade medical-grade Nylex. A Nylex is an antimicrobial, moisture-resistant cover that's also soft and supportive for the skin, so it doesn't cause sweating, it breathes, and it's disinfectable and cleanable. You could use Chloropreps or whatever to clean it between patient use. So it is reusable, which makes this cushion a lot greener than the disposable devices available out there now. So anyway, you simply put the cushion under the patient's legs in whatever position is comfortable. If you can see a typical supine position here, you can slide the cushion so that her ankles are actually supported, Achilles tendons supported over the soft areas of the memory foam, but the heels are well elevated from the bed. The low profile allows for positioning in any position. So if you have a patient that requires better circulation, you can always slip the pillow this way. You can find a position so that the calves are, pressure distribution across the calves is good, but the popliteal artery is open so the patient gets circulation. In a side positioning, why don't you face that way, Anne, the side positioning model. If you're putting your patient in a 30-degree position, the patient will naturally want to bend their legs a little bit. In this case, you can shift the pillow such that to accommodate the patient's position in the position that they choose. So you can see here that she's got her her feet floated over the holes, yet supported. If she bends this leg, she may end up over this hole, where she's not getting any direct contact, and even though her foot is coming off the cushion this way, we're still getting pressure distribution, pressure relief on her heels over the sides. If you find, I'm stealing your head pillow again, the patient requires more support on her knees, of course the $2 pillow is compatible with the cushion, allowing for support under the legs. Also, if she bends her knee, she will still end up in a supported position, and her legs will still be floated, even though she's naturally choosing positions of more comfort. When the patient's bending their legs a lot, there's no reason why you shouldn't be able to turn the cushion to a position that allows for support under the legs and elevation of and support of the heels. This cut first.
Okay.
Okay, so one thing to remember when you're using this HeelBone cushion is that if you notice that the musculoskeletal alignment of this patient is basically level. So you don't want to do this, which is a tendency a lot of caregivers do, where they have the knee gatch up. It actually twists the lower sacral area and applies more pressure on the greater trochanter in a side-laying position. So be sure to have the knee gatch as low as possible at all times when you're turning, when you have a patient turn to their side. And also remember that no cushion or device could possibly replace frequent turning and frequent checks on care. So, okay, the one last thing I wanted to point out with this cushion, it is a comfortable cushion. The patient should feel a little bit more soft because they can shift their legs to a position of comfort. But even when the patient extends or spreads their legs to an extended position, what you'll find is they'll tend to find a position so that they can get less pressure against their calves. So the cushion is wide enough to allow the patient to spread their legs without actually losing elevation, losing pressure relief on their heels. So thanks again for your time. Please be sure to call me if you have any questions, and stop using the $2 pillows. I think that we might want to reconsider once we get the good pressure relief with a wedge to use a pillow what it's made for. There, how's that? Comfy? Good, thank you, and have a nice day.